your host, Amberlynn Carroll. Thank you for joining us on this episode of Medwatch Today. According to the National Alliance on Mental Illness, 50% of all lifetime mental illnesses begin by the age of 14. That's why experts say having an open conversation with your child should start when they're young.
Our youth have experienced mental health challenges ongoing. However, through the pandemic, we've seen an increase in our youth that are expressing signs and symptoms of depression and anxiety.
Talking to your teens about mental health can be a tough conversation to start.
Not knowing the words to use is part of a challenge.
Christina Valdez-Roup is the executive director for the Central Valley National Alliance on Mental Health and says the environment in which parents have these conversations matters.
Not feeling safe enough to be able to open up and share is a challenge as well. And then knowing that something's not right and needing the appropriate care, and that care not being available can be another challenge.
Environmental factors and even bullying can cause teens to go inward and start questioning or comparing themselves to others.
Do we need a change in our environment? Do we need a change in our diet? Do we need a change in our physical involvement? Are we in safe space?
And Christina says finding resources can be a step-by-step process.
That might be off a school site with mental health professionals, available in different settings, whether that be a provider, mental health provider's office. Maybe it starts at a pediatrician's office.
But being aware of changes in a child can be the first step on the journey to mental wellness.
Things to pay attention to is, did this person who was an A student, just to be extreme, now failing classes, not engaging anymore in the education process, doesn't seem to care, giving up on life kinds of things would be key indicators that the person is going through something.
Clinical psychologist Dr. Rick Adams with the Community Behavioral Health Center in Fresno says if parents or caregivers notice a decline in a child's mental health or see signs of self-harm, the key is to have an open, non-judgmental conversation and make sure the child knows you're always available to talk or just listen.
Not be put off by that, but don't get aggressive with it. In other words, give them space, but let them know that you're concerned and you've observed some things and you'd love to talk about it and try and help them, but back off and say, I'll check in with you again tomorrow, but this is something that it's, I love you, this is very important.
To learn more about having open conversations surrounding mental health with your teens and find mental health resources, visit NAMI.org. If you or a loved one is experiencing a mental health crisis, dial the suicide hotline at 988.